Team Sameeksha presents Aatanka, a national level paper and poster presentation. And I welcome you all to the final day of Aatanka. Now you all have joined. We can start without much delay. It's already 6:10. And before that, let me welcome our panel members. First of all, I invite our Agatantra panel, Dr. Sri Lakshmi, Dr. Veena, and Dr. Shankaraj. Now I invite Panchakarma panel, Dr. Rajanisha, Dr. Pramila, and Dr. Suganyasa. Now I welcome Dravyaguna panel, Dr. Bindu Pillai, Dr. Sridevi, and Dr. Shija. Now I would like to invite Kaumada Pratya panel, Dr. Shrija Ashok, Dr. Ramya, and Dr. Ansiba. I invite Samhita panel, Dr. Veena Vijayan, Dr. Reshmi, and Dr. Krishna Priya. I welcome Nidana Tantra panel, Dr. Srilada Soman, Dr. Nitya, and Dr. Arya. Now, let me invite Prasuti Tantra panel, Dr. Kumari Velayudan, Dr. Kavita, and Dr. Ashwani K. I invite Swastavrta panel, Dr. Indira Menon, Dr. Shilpa, and Dr. Kirti. I welcome Kai Chigilsa panel, Dr. Mathavan, Dr. Vinita, and Dr. Surya Cherak. I invite Manasika panel, Dr. Nitin Darade, Dr. Umar Jadhav. Now I invite Shalyatantra panel, Dr. Vaishak, Dr. Ravinder Singh, and Dr. Pratibha Somraja. Now, let me invite the Sambhaishija panel, Dr. Arunlal and Dr. Preeti. I welcome Shalakitantra panel, Dr. Krishna Prabha, Dr. Devika Pradap, and Dr. Revati Raghu. I invite Kriya Sharira panel, Dr. Kiran Kumar and Dr. Ramya. And finally, I invite Rajna Sharira panel, Dr. Roshli Raghav, Dr. Ramya Bhushan, and Dr. Divya Prabha. So now we can start, but before get start, let me remind you the rules and regulations. The presentation will be live on YouTube and the copy saved in broadcast website. So don't unmute unnecessarily. And your maximum time limit for the presentation is 8 minutes. And I repeat, your maximum time limit for the presentation is 8 minutes. So I welcome our first participant for the presentation. And I wish all the very best to each and every participant. Now I invite Dr. Kiran Dipak for the paper presentation.
Good evening, ma'am.
I invite Dr. Kiran Dipak.
Good evening, ma'am.
Good evening, doctor.
Sir, can you share my PPT, sir, please?
Okay, doctor, 1 second.
Thank you, sir.
Dr. Kiran Deepak Kashid, please start.
Yes, sir.
Please.
Thank you, sir. Good evening, everyone. Myself, Dr. Kiran Dipak Kashid, PG second year from Shalya Tantra. Today, I am presenting my topic, therapeutic aspect of Agnikarma and its importance in current practice under the guidance of Dr. Shilpa Badhe, HOD and guide at Shalyatantra Department from SMBT Ayurveda College and Research Institute, Dhamangav, Igatpuri, Nashik. Introduction. Shalyatantra is one of the important branch of Ayurveda based on 4 major managements such as Vaishali Karma, Kshara Karma, Agnikarma, and Shastra Karma. Agnikarma is superior among them and boon for local vat and kapha vadhi. Agnikarma means application of Agni directly or indirectly with the help of different materials to relieve the patient from disease. It's prime parasurgical procedure to treat chronic diseases which are mostly difficult to manage because of antagonist property of dosh like kapha and vat. Atharva Veda has identified Agni as a god and treatment for disease. It's clear that Agni was used to protect the body from invading microbes. Sterilization by healing process uh, can interpret as idea of Atharva Veda. Derivation and definition. Agni Gata from Amarkosh. The word Agni is derived from Dhatu Anga, which means Gati, that explains about the movement, transformation, and spreading. Agni is a foremost among that which control our body and responsible for the Janma, that is life, and Karma means action. It comprises of the 2 terms, Agni and Karma, which represents fire and procedure respectively. Agnina Krutva Yat Karma, Agnine Sambandha, Va tat karma, tad agni karma. The treatment protocol done using fire or which is related to fire is called agni karma. Importance of agni karma. The agni karma is considered to be a better than shara karma. The disease treated with proper agni karma has no chance of recurrence. It cures the disease which are not managed with the bheshaj karma, shastra karma, and the shar karma. The Hippocrates says those diseases which medicine do not cure, knife cures. Those which iron not cures, cure fire cures. And those which fire cannot cure are to be reknocked wholly and incurable. The Hanopakarna are the instruments or the materials used to produce the therapeutic burns, that is the Samyak Dagdha. During the Agnikarma Chikitsa, the various Dhanopakarna of various origin like plant origin, animal origin, metal origin are mentioned, which are selected according to disease and site, etc. Acharya mentioned the different materials to perform Agni Karma in different structures for the temperature regulatory purpose. Classification of Agni Karma, the type of akriti, that is a shape based on the dravya used. Third one is a sthan or the part to be cauterized. Fourth, based on which the disease is site. And fifth, the nature of the disease site. According to Akriti, the vallai, that is a circular, encircling the root of the disease portion. Bindu, dots made with the tip of shalaka. Vilekha, straight curved or the horizontal line drawn with the shalaka. Pratisaran, rubbing with the side of the shalaka. According to Acharya Vagbhat, Ardhachandra, that is a semilunar or the crescent shape, swastik shaped, and Ashtapada directed in 8 directions. According to the dravya used, Snigdha Agnikarma by means of Madhu, Grita, Taila for the diseased situation in Sira, Snayu, Sandhi, and the Asti. Ruksha Agnikarma by means of Pipali, Kshara, Shalaka, and Godanta. Sthana or the part to be cauterized. Tatra Dvividham Agnirmahurekam, Tvagadagdham, Mansadagdham cha, Iha tu Sira, Snayu, Sandhi, Asti, na Pratishidho Agni. Cauterization mainly of 2 types, Tvakadagdha, that is a skin burning, Mansadagdha, muscle burning, Sira, Snayu, Sandhi, and the Asti. According to the disease, in diseases like Kadar, Arsha, etc., Agnikarma is done for Chedan Karma, that is surgical excision. In diseases like fistula, sinus Agnikarma, done after the Bhedan Karma, that is surgical incision. In Krimi Danta, done after filling the cavity with a Guda and Madhujishta, etc. Indication of Agni Karma. Tvaka Mansa Sira Snayu Sandhi Astya Sthite Ati Ugra Ruji Vayushchita Kathina Supta Mansa Vrane Granthi Arsho Arbuda Bhagandara Apacho Shlipada Charmakila Tila Kalak Antra Ruddhi Sandhi Sira Snayu Adi Nadi Shonita Ati Pravrittishu Chagni Karma Kuryata from Sushrut Sutra. The pain aggravated by vat in a tvacha, mansa, sira, snayu, sandhi, and the asti, the chronic wound having some hard elevated tissue, the cystic lesion, hemorrhoids, tumor, fistula, sinus lymphadenopathy, skin tags, joint disorders, and to stop the bleeding from the cut vessels. Contraindications of Agnikarma. Tatra Agnikarma सर्व ऋतुषु कुर्यात् अन्यत्र शरद ग्रीष्माभ्याम. Agnikarma can be done in all seasons of year except in Sharad and Grishma. अथेनमान अग्निनाम परिहरेत पित्त प्रकृतिम अंत शोणितम भिन्न कोष्ठम अनुद्रुत शल्यम दुर्बलम वृद्ध भीरु अनेक व्रण पीड़ित अस्वेद्याश्चैति. All types of pitta and raktas disorder, patient with a concealed bleeding, intestinal perforation, retained foreign body, weak person, children, old age person, and a patient with a multiple wounds and who are not fit for the Svedan karma. According to Charat Chikitsa, Agnikarma should not be done in vrana of snayu, marma, netra, kushta, and vrana with a visha and shalya. According to Ashtanga Hridaya Sutra, Agnikarma should not be employed in a person who are contraindicated for a Kshara karma. Purva karma for Agnikarma. Rogasya संस्थानम आवेश सम्यकम नरस्य मर्माणि बलाबलं च व्याधि ऋतु तथा ऋतुम च समीक्षा सम्यक तथो व्यवस्थित भिषगम Agnikarma. From Sushrut Sutra, pre-Agnikarma assessment of physician or the Vaidya, after having a careful analyzed the seat of disease and examining the individual for the strength, locations of the marma, disease and season, should be resort to the Agnikarma. सर्व व्याधिषु ऋतुषु च पिशिलान्नं भुक्तवतं कर्म कुर्वितः अश्मरि भगंधर अर्शो मुख रोगेषु अभुक्तवतः. Pre-Agnikarma diet in all diseases and in all seasons, the patient should be fed on a diet which is pishtil before the Agnikarma, while the patient should be on empty stomach before the therapy. In the case of Mudagarbha, that is a malpresentation of fetus, Ashmari, renal calculi, Bhagandar, fistula in ano, Udar, ascites, Arsha, hemorrhoid, and Mukharoga, diseases of oral cavity. Pradhan Karma. According to Sushrut, before doing the procedure of Agnikarma, Swastik Vachan should be done. The patient kept in a suitable position by keeping the head in the east direction and held by the expert assistant to avoid the movement. After this, surgeon should make the different shapes of Agnikarma, Valaya, Ardhachandra, Swastik, etc. as per the need by heated shalaka in a smoke fire free of Khadir or the Badar. During this period, if patient feel discomfort, then keep them satisfied by courageous consolation talk, give cold water for drink, and sprinkle cold water. But the procedure of Agnikarma should be done till the production of complete cauterization, that is Samyak Dagdha. Samyak Dagdha Lakshan, Samyak Dagdham, Anavagadha, Purva Lakshan Yuktam, Chatala Varna, Susanhitam, Anavadagdha, Vranata, wound which is not deep. The Tala Phala Vranata means the fruit of Tala, the tree Asian palm fruit. Susanhita Vrana, without elevation or depression. This is not considered as an injury when performed for the therapeutic purpose. If the above signs and symptoms occurs that indicate the perfect Agnikarma, that is a Samyak Agnikarma. Samyak Dagdha Lakshan in various dhatus. According to Acharya Sushrut, for Tvaka Dagdha Vrana, Shabda Pradurbhav means production of sound, Durgandhata, bad odor, and contraction of skin, that is the Tvaka Sankoch. For Mansa Dagdha Vrana, Kapota Vranata, color like that of the pigeon, that is the ashy dark grey. Alpa Shatu means mild swelling, and Tvaka Sankuchita Vranata, dry contracted wounds. Krishnonnata Vranata, Strava Sannirodhascha, Sira Snayu Dagdhe. In Snayu Dagdha Vrana, black discoloration, elevation, and stoppage of discharge. In Sandhi Asti Dagdha Vrana, dryness, red color, roughness, and firmness is there. From these lakshans, we can say the Agnikarma is to be perfectly done. In Paschat Karma, the madhu, honey, and the grita, ghee should be applied after the Agnikarma procedure. The paste of Tugakshiri, Palaksha, Chandan, Amrit, and Gairik with the grita can be used as an ointment for local application. The paste of flesh of some animals like horse, pigeon, etc. may be used as a lap or the ointment for the local application, for local as well as for the internal medications also. If a person doesn't get relief from above medication, that surgeon should follow the line of treatment like Pitta Vidradi. Madhujishta Grita prepared by processing of wax in Grita with Madhu, Yashti Madhu Lodra, Rala, Sarjaras, Manjishtha, Raktachandan, and Murva. The reference from Sushrut Sutra. Itartha Dagda. The word Itartha Dagda indicate the other kind of burns other than the Samyak Dagda caused by the mistake of Vaidya or the doctor. It is of two types, Snigdha and Ruksha. Acharya stated that the Snigdha Dagda is more painful than the Ruksha because of ability of penetrating into a minutized vessels.
Dr. Kiran Deepak.
Yes, ma'am.
Doctor, you are exceeding the time limit.
Okay, ma'am. Here I explain the mode of action of Agnikarma. For the Agnikarma, with the help of Ushna Guna, it improves the Dhatavagni. Manda Dhatavagni gets pacified, and Amapachan and the Vatshaman is to be done. The next Agnikarma in Shalyatantra Vadis like Sadhyavrana. The wound should be developed after the limb excision, which can be cauterized with the help of Agnikarma Shalaka. Agnikarma in Granthi. The Granthi occurring in any part of body other than marma suppurated should be opened and cauterized with fire. Agnikarma in Kapha Jarbut. Next slide, sir. When only small remnant remains after the worms have been eaten, the area should be scraped or cauterized with Agni. In Upadansha also, in Ashmari Vrana and other conditions, Agnikarma can be performed. Here I have given the references and explained it also. Agnikarma in Chippa and Kunak. Agnikarma in Vidradi. And Agnikarma can also be performed in Jatumani, Mashak, Tilakalak. Here I given the photos of it also. For the hemostatic purpose, the main importance of Agnikarma for the contraction of Sira, that is the Sira Sankoch in Agnikarma, and the cauterization is to be formed and the hemostasis is achieved. Agnikarma in Charma Kilak, that is in warts, we can done. I have shown an image which I have performed. Agnikarma in Kadar or in corn. In a corn, we can perform excision as well as Agnikarma also. Agnikarma in Bhagandar. I have given the reference of one image. Next, Agnikarma in Arsha. Current practices of Agnikarma. This kind of instrument we are using with a modified shalakas. Cauterization in modern techniques. So in modern sciences, electrocauteries are to be used. That is the monopolar cauteries and the bipolar cauteries. So next slide. I have given the mechanism, how it works actually, and a little bit trying to explain it better. Challenges of faced in Agnikarma, most important is of consent, then fear of scar formation, burn, and the transmission of the infection. Those are the challenges which are faced by discussion Agnikarma, as I previously explained in introduction also. The Agnikarma, one of the important procedure have explained by the Sushruta for the cauterization purpose and the disease destroying agent. Conclusion: the technique and equipment have become advanced, but the basic principles remains the same. That is the main. We should apply with the basic rules and no recurrence of disease. Good measurement for the hemostatic purpose. And thank you. Thank you, ma'am.
Thank you, doctor, for this wonderful presentation. So next I invite Dr. Aarti Haribhau. I invite Dr. Aarti Haribhau.
Good evening, ma'am.
Good evening, doctor.
Hello.
Good
Ma'am,
evening,
can
doctor.
you share my screen first, please?
Okay, doctor, 1 second. I will share for you.
Okay.
Dr. Aarti, please start the session, doctor.
Okay. Good evening, everyone. Myself, Dr. Aarti Kunde, PG Pediatric second year student of SMBT Ayurvedic College and Hospital, Ramandau. So here is my topic. Today's topic of presentation is obesity in children. Basically, next slide, please. Introduction. Obesity implies excessive fat and not merely excessive weight. Body weight is not a reliable criteria for defining obesity. A few clinical parameters like a body mass index, weight for height, skin fold thicknesses, and waist circumferences usually used as a markers of obesity. Obesity can be can be of a different type like exogenous, endogenous, and physiological obesity. Exogenous occurs as a result of excessive diet or which is one of the most important nutritional problems. Next slide, please. Endogenous obesity, which is related to genetic or chromosomal syndrome. Third is obesity, which causes generally in a kapha pitta prakriti and kapha pitta prakriti and kapha prakriti. Whereas physiological obesity usually occurs in early adolescent period and is frequent among girls only. It is temporary phenomena and will regress after adolescence. Management of obesity includes different approaches like diet restriction, encouraging greater physical activity, supportive therapies, and even surgical options also. Prevention of obesity is very much essential now, and it can be done by a various proper. It can be done by giving proper awareness. Next, please. Vital data. Here I'm presenting one case. Patient name is XYZ, age of 8 years, female child, and has her all the details, OPD, IPD number, and address. Is one of the patients from the OPD. Next slide, please. She's a female child of 8 years old and admitted in the pediatric ward, presenting the complaint she has excessive weight gain since 6 months, excessive sweating of her body, and blackish discoloration around the neck since 3 months. An associated complaint was increased desire for a food since 6 months. Or history of present complaint, this patient was active, later started sudden weight gain from 6 months and excessive sweating of her body and blackish discoloration around the neck since 3 months. No any past family history. History of habits. Habits of taking plenty of sweets, chocolates, bakery foods, items, and fast food. Moreover, she always liked to have her food in front of the television. Next, please. So developmental history, all developmental milestone is attained at appropriate time, age of at appropriate age. All vaccines are given according to the schedule. Examination. On examination, bowel was regular. Appetite is increased recently. Maturation was normal. Sleep sound. Next. Anthropometry on admission was weight was 14.1 kg, height 124, head circumference 51, chest circumference 56, mid-arm circumference was 17.5. Next slide, please. Chief complaint was excessive hunger and foul smelling of body, distressful sweating, lack of enthusiasm, debility, and excessive thirst. Next, please. Now the treatment part. A single course of treatment which comprises of a Dipan Pachan, Snehapan, Udavartan, Nadi Swedan, and Virechana along with the sthoulya, sthoulya, sthoulya roga aushadhi was given. Dipan Pachan with a Dipan Pachan with the Chitrakadivati and Panchakola Fanta, Udavartan and Nadi Swedan. Snehapan with the Varunadi Grita, Virechana with the Trivrutta Avaleha and Draksharasa. Total number of Vegas 8. Advised at the time of the discharge. One is Sansarjan Kram for the 3 days. Then Varunadi Kashai 7.5 ml. Haritaki Khanda 1 tablespoon BD with the lukewarm water and Ushnogna Jalapan and diet advice. Outcome of the treatment. Anthropometric blood that was before treatment on admission was 14.1, after treatment 38.7, height was 128, after also 128, head circumference was the same, chest circumference, and B-ram circumference. The rest of the parameters were the same. Only BMI has changed from 31.3 kilogram per meter square to 30.2 kilogram meter square. Next slide, please. Now, observation. This child was abroad with the complaints of excessive gaining of weight when compared with other children of same age group and associated with increased interest towards the food. In 6 months, remarkable changes were noticed in the appetite and digestion of the child. After the treatment has started, child has excessive desire for taking food in large quantity has reduced, and this child was said to have a generalized weakness in the body. After the course of treatment, general health status has improved. Next, please. Also, weight has reduced from 41.41 kg to 38.7 by the completion of the same days of the treatment. And sweating of the body is excessive was another complaint at the time of the admission, which has reduced an extent. There was a feeling of lightness of the body after the purification of the body with the virechana karma and pashat karma. Now the discussion part is the present case was diagnosed as a sthaulya in Vata Kapha Adhikya Avastha with the Agnikarma at a Koshta and Dhatu level. Kaya Virechana was done as the Shodhan Chikitsa. Ruksha Purvaka Sneha Pan was performed before Shodhan as the patient was having the Virukta Maunsa and Medha Dhatu with treatment given by assessing Prakruti of the child. Now the conclusion, there was a significant improvement in the subjective and the objective parameters after treatment. Hence the Ruksha Purvak Snehapan followed by the Virechana Karma was a crucial role in the management of the exogenous obesity in children. Thank you.
Thank you, doctor. Now I invite Dr. Darshan Balkrishna. I invite Dr. Darshan Balkrishna.
Good evening, ma'am.
Good evening, doctor. Doctor,
Good
please share
evening,
the
sir.
screen.
Hello, sir. Can you please share my PPT?
Doctor, 1 second, doctor. Hello, doctor. Please chat the session, doctor.
Good evening, everyone. Myself, Dr. Darshan Balkrishna Sarmalkar, final year MD student from Kai Chikitsa Department, SMBT Ayurvedic College and Hospital, Nashik. Under the guidance of Dr. Ankush Gunja sir, here I am presenting a PPT, a case study on Ayurvedic management of hypothyroidism. Introduction. The pathology of thyroid gland are broadly divided into two types. First one is a structural pathology, such as colloidal goiter, abscess, malignancy, and second one is a functional pathology such as hyperthyroidism and hypothyroidism. There may be a third variety which is blend both of structural and functional pathological conditions. Sometimes may also have a complication in all the above conditions as grave disease. Each of the pathology presents with its own sign and symptoms. Here in this study, the functional pathology of thyroid gland is elaborated, that is hypothyroidism, which present itself with the complaints of tiredness, weight gain, hair loss, cold intolerance, mood disturbance, indigestion, dry rough skin, and treatment to this condition is hormonal replacement. This clinical picture mimics the condition of sthaulya and hence it has to be treated in terms of sthaulya chikitsa. The treatment of this condition mainly focus on Shodhan and Shaman. Vyadhihar, Rasayanal and lot of clinical studies done on management of hypothyroidism, plus less emphasis laid on trying Shaman Aushadhis. So the present case report shows the successful management of hypothyroidism. The case presentation: a female patient with the age of 39 years consulted in an outpatient department of SMBT Ayurvedic College with the complaints of weight gain associated with increased tiredness and hair loss since 6 months. She has a known case of hypothyroidism since 10 years with a regular medication of thyroxine 75 mcg in the morning daily before food. Her previous weight was 64 kg. Now she is increased to 74. She also presented with indigestion and dry rough skin. There is no history of diabetes and hypertension, cardiac problem, or any other complicated diseases. The appetite is reduced, sleep is sound, bowel is regular, and micturition is 4 to 5 times a day. All the vitals and systemic examinations were within normal limits. The thyroid local examination: on inspection, localized swelling was absent. On palpation, normal shape, and on localized temperature, there was no raised tenderness, and localized temperature was absent. Materials, next slide, sir. Materials and methods. The treatment was planned seeing the state of roga bala, that is strength of the disease, and atur bala, that is strength of the patient. The following medicines are administered to the patient for the period of 2 months. The patient was advised to indulge in a light diet and barley and exercises. So next slide, please. This is the column. Then there are 3 drugs used, that is Yashti Madhu, Dhatri Lo, and Nityananda Ras. Yashti Madhu dosage: 2 capsules before food, thrice a day with lukewarm water. Dhatri Lo with 1 tablet before food, thrice a day with lukewarm water. And Nityananda Ras with a 2 tablet after food, thrice a day with lukewarm water. The results were before treatment and after treatment. The weight before treatment was 74 kg. After treatment, it reduced to 69. Fatigue was 80%. After treatment, it reduced to 20%. Hair loss 90% before treatment. After treatment, it reduced to 30%. Dry skin before treatment, it was 70%, which was reduced, which after the treatment reduced to 40%. Indigestion before treatment was 80%. After treatment, it reduced to 2%. Also the investigations which are done, you can see as T3 before treatment was 70. After treatment, it comes down to 68. T4 8.26. After treatment, it comes down to 6.76. TSH before treatment 49.6. After treatment, it reduced to 12. There is also a graph which shows the fatigue, hair loss, and indigestion, dry skin after and before treatment in patient. Now the discussion part. This clinical picture of hypothyroidism mimics the condition of sthaulya, and hence it was treated in terms of sthaulya chikitsa. Suitable shaman aushadhi was planned in this case. Yashti Madhu helps in dry skin condition. Dhatri Loha treats indigestion, and Tridoshahar and act as a rasayan also. Nityananda Ras is very beneficial in case of Mansa Medogat Vikaras, as sthaulya is Meda Pradhan Vyadhi. Each and every ingredient in Nityananda Ras possesses the quality of Vata Kapahara, and it has the properties like Lekhan Rasayan. Yava, which is having Rukshan property, that is potent lipid reducing effect that helps in depleting excess of fat while providing essential energy required for maintaining daily life. This is the drug, and it with the contents inside it and properties and action. As we can see, Dhatri Lo has a properties of Tridoshahara and Rasayan property. Nityananda Ras has property of Vata Kapahara, Agni Dipan, Am Pachan, Lekhan, and Rasayan property. And Yashti Madhu with the content Yashti Madhu properties and actions are Stotahara, then Bala Varnakrita, and Vata Pittahara. Now coming to the conclusion, from the above study, it can be concluded that Nityananda Ras, capsule, Yashti Madhu, and Dhatri Lo effective in management of hypothyroidism. So there was a significant reduction in the signs and symptoms of the disease, and also in thyroid profile report. The medicine showed encouraging results in this case. The results needs to be studied in more numbers and patient for the better assessment. Here are some references for my study in the next slide. Thank you.
Thank you, doctor, for this wonderful presentation.
Thank you,
Now
ma'am.
I invite Dr. Vaishali Dnyaneshwar. I invite Dr. Vaishali Dnyaneshwar. Dr. Vaishali.
You, Dr. Vaishali, are you there? Okay, next I invite Dr. MADHURI OMPRAKASH DHOMANE for the presentation. Dr.
Yes, sir.
MADHURI.
Yes, sir.
Okay, Doctor, please share the screen, Doctor.
Good evening, everyone. Myself, Dr. MADHURI OMPRAKASH Dhomane, PG Scholar Shalya Tantra from Dr. VJD Gramin Ayurved Mahavidyalay, Patur, Akola, Maharashtra. Today my topic is the role of diet in Atisara Roga with special reference to Annavaha Srotas, a literature review. Introduction. Ayurveda is an ancient science and broad aim science. The main aim of Ayurveda is to maintain the health state and cure the diseases. The disease Atisara is an acute disease which is broadly spread all over the world. This is disease which can affect all age group and both of the sex. Contaminated food and contaminated drinks are mainly etiological factor for this disease. There are so many drugs available in the contemporary science, also generally use antibiotic and symptomatic medicines to cure the diseases. But this drug may cause little side effect of annavaha strotas. Atisara nirukti. The excessive elimination of apadhatu with the stool from guda is known as Atisara. It is ashukari disease. If it is not treated properly in a time, it may cause severe dehydration and death also. Charak Samhita describe following types of Atisara. Number 1, Vataj Atisara. Second, Pittaj Atisara. Third, Kapaj Atisara. Fourth, Sannipatik Atisara. Fifth, Bhayaj Atisara. Sixth, Shokaj Atisara. Seventh, Amaj Atisara. Eighth, Raktaj Atisara. Symptoms. Sveta Purish, Snigdha Purish, Pichil Purish, Tantumay Purish, Amayukta Purish, Guru Purish, Durgandhi Purish, Udarshul, Pravahan, Guruta in Guda, Basti, function like symptoms. Aims and objectives. First, to take review and undergo study of Atisara Vyadhi from Ayurvedic literature, to study the role of diet in Atisara and create awareness in a people. Materials and methods. First, Ayurvedic Samhita and textbook, modern textbook, online data and journals. Review of study is explained under following headings. Pathya. Pathya is a way of living, disciplined diet and lifestyle as per Ayurveda. Liquid intake, coconut water, resin water, boiled water. Rice green gran khichdi, laja manda, sali laya, rajgira laya. Fruits like jamun, apple, nutmeg, carrot, onion, black salt, etc. Apatya. Apatya is a form of lifestyle or diet which is the basic cause of disease. So by studying about apatya, we have to avoid them. As the lifestyle of today's people becomes so modernized, they are regularly doing apatyas in daily life, like non-veg food, fruits like mango, watermelon, pineapple, excess cold water, and drinking buffalo milk. Discussion. Atisara is a most common disease found in a children. Diarrheal disease rank among the top 3 causes of death in pediatric population of the developing world. Right out of 10 deaths are in the first 2 years of life, the most susceptible period for the malnutrition. It is unfortunate that death due to the Atisara, even though it is preventable, it causes the death of children in such a huge number. Information on diarrheal disease is a determination, prevention, and control strategy. With the help of Ayurveda is important for the better planning and organization of health service and limit the mortality and morbidity with the diarrheal disease. There are many drugs and Ayurvedic compositions mentioned in Ayurvedic texts and granthas, which are not researched for their efficacy and are not used. In order to bring such a drug in a mainstream, research is needed, and so the research will be done. In other system of medicine, only treatment plan for diarrhea is a prevention and correction of dehydration, not actually treating the disease, so there is a need of drug which treat diarrhea and prevent dehydration also. Conclusion. As Ayurveda is a science, mainly gives the importance to the prevention. Following good diet and lifestyle is the key of healthy being. Acharya has also stated that if you follow pathyas, the disease will cure easily and the medicine will increase the efficacy of medicine, also maintain Agni in a Sama Avastha. And as Agni is a reason to all the health and wealth, by maintaining the Agni, we are adopting disease-free and healthy life. And if Agni is a good, will prevent Atisara and all disease, it will help fast recovery. These are the references. Thank you.
Thank you, doctor. And instead of next participant, let me invite Dr. Darshana Sharath for the next presentation due to some emergency situation. Dear participant, please cooperate.
Hello. Yes, ma'am. Can you please share my PPT?
Just a moment, doctor.
Doctor. Doctor, please start the session, doctor.
Okay, sir. Good evening, all. Myself, Dr. Darshan Balkrishna, PG scholar of Shalya Tantra Department, SMBT Ayurvedic College. Next slide. Today, I am going to present breast cancer, surgical anatomy, breast or mammary gland, modified sweat gland lying on pectoral fascia and musculature of chest wall, surrounded by skin and subcutaneous fat, found in both sex but rudimentary in male, hemispherical in shape. Next slide. Situation: overlying second to sixth ribs, extending from lateral border of sternum to anterior axillary line, further extends from clavicle above to the seventh or eighth rib below, and from midline to edge of latissimus dorsi posteriorly. Important: when performing MRM, that is modified radical mastectomy, remove the whole breast. Next. Axillary tail, part of the breast which is in axilla called as axillary tail, palpable or can be seen premenstrually or during lactation. Well-developed axillary tail, sometimes mistaken for mass of enlarged lymph node or lipoma. Next slide. Structures of the breast. First, nipple, located in fourth intercostal space near its apex, lie the orifice of lactiferous ducts. Second is the areola, contains involuntary muscles. Montgomery tubercle, sebaceous glands appear as small bumps around dark area of nipple. Third is lobule, basic structural unit, terminal, ampulla, reservoir for milk and abnormal discharge. Fourth is the ligaments of Cooper, hollow conical projections of fibrous tissue. Importance, dimpling of skin overlying carcinoma. Next. Fifth is the lymphatics, predominantly drain into axillary and internal mammary lymph nodes, and axillary lymph nodes receive approximately 85% of drainage. Groups: lateral, anterior or pectoral, posterior or subscapular. Fourth, central, and fifth one is the apical. Sentinel node, first lymph node draining tumor bearing area of breast, internal mammary lymph nodes, and supraclavicular lymph nodes. Next. CA breast, it is the most common cause of death in middle-aged women. Risk factors for breast cancer are as follows: older age, dense breast, having breast cancer before, parent or sibling with breast cancer, inherited gene mutations, Ashkenazi Jewish ancestry, alcohol use, and overweight or obesity. Next. What is breast cancer? Breast cancer occurs when healthy breast cells become abnormal, grow out of control, and forms tumors. What is 1 in 8 women or 1 in 1,000 men will be diagnosed with breast cancer in their lifetime. Next. Types: DCIS, that is ductal carcinoma in situ, and next second one is the IDC, that is invasive ductal carcinoma. Next slide. Next type is the cancer in lobes, that is lobular carcinoma in situ, and cancer in the lobes, invasive lobular carcinoma, abnormal cells spread to surrounding tissue. Next, signs of CA breast. First sign is lump. Second is the change in shape or size of the breast, nipple changes, nipple discharge, skin changes, and skin changes like skin dimpling. Next, these are all the pictures of dimpling sign, then nipple inversion, breast erythema or nipple inversion. Next, PUD orange. It is the most precious sign in CA breast. It is orange-like appearance. Next, breast examination. First one is the inspection. Examination of diseased breast. Symmetry and position in comparison to normal side. Size and shape in comparison to normal side. First, nipple. Position, drawn up or pushed down. Displaced inward or outward. Size and shape of the nipple. Surface, any crack or fissure. Any nipple retraction. Any discharge from nipple. Any ulcer over nipple. Next, areola. Size, any diminution of size due to retraction, any crack, fissure, ulcer or eczema, any discharge. Skin over the breast, scar, engorged vein, pigmentation, any redness or shininess, any skin changes like dimpling, retraction, PUD orange, nodule and ulceration. Next, any swelling in the breast, position in relation to breast quadrants, extent and surface and margin and skin over swelling. Next, any edema of the arm, inspection of the breast with arm raised overhead, nipple retraction become more obvious in this posture. We can see in the image. Next, inspection with the patient leaning forward, left breast, that is normal breast, is falling more forward than diseased right breast, suggestive of fixity of breast to chest wall or pectoralis major muscle. Next, inspection with the patient sitting and hands pressed on waist. Note that skin dimpling becomes more obvious. Next, inspection with the patient in recumbent position with head end up by 45 degree. Note that whole breast including inferior quadrant seen better in this position. Next, palpation. Normal breast palpated first. Temperature, tenderness over the breast, any swelling, size, shape, surface and margin, consistency, fixity to skin, fixity to breast tissue, fixity to underlying pectoralis fascia, fixity to chest wall, fixity to serratus anterior muscle, for lumps in the outer quadrant of breast, if cystic swelling, fluctuation and trans-elimination. Next, triple assessment, clinical assessment, age examination, imaging, USG and mammography, pathology, FNSC, that is fine needle aspiration cytology, core needle biopsy, open surgical biopsy or sentinel lymph node biopsy. Next, diagnosing breast cancer, diagnostic mammogram, breast ultrasound and breast MRI. Next, mammography, soft tissue radiograph, screening for asymptomatic individual and diagnostic mammography for symptomatic individual. Start at 40 for asymptomatic females, repeated annually. Next, characteristics of malignant lesion in mammography, architectural distortion of breast tissue, duct dilatation, dense soft tissue mass with irregular margin and spiky projection, nipple retraction, increased thickness of skin due to lymphedema. Next, ultrasound in premenopausal woman, that is less than 30 with dense breast tissue. Mammography may not detect small lesion, so USG is better to detect breast lesion. USG can detect the mass as solid or cystic. No radiation, cheap, easily available. USG guided aspiration of cyst or USG guided biopsy from solid lesion may be done. Next, MRI, useful in young patients with the dense breast for detection of non-palpable mass to distinguish scar from recurrence in women who had previous breast conservation therapy for cancer. Next, Biopsy, core needle biopsy, standard method, or no wedge of tissue is taken. Next slide. FNAC, it is the most common method for diagnosing of breast mass, but FNAC not differentiate invasive or non-invasive breast carcinoma. Next is the incisional biopsy. In 90% of cases, core biopsy is helpful for diagnosis, but in 10%, when core biopsy is inconclusive, incisional biopsy is considered. Sentinel lymph node biopsy is positive when axillary dissection undertaken and negative axillary dissection, axillary surgery avoided. Next. These are the stages of breast cancer, stage 1, stage 2, 3, and 4. In first stage, tumor size is less than 2 cm, lymph node involvement is no, metastasis no. In second, what is metastasis? Breast cancer. Metastasis is spread to lungs, brain, bones, liver, etc. Next, breast cancer treatment, surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and combination treatment. Next, surgery to remove the tumor, lumpectomy, simple mastectomy, modified radical mastectomy. These are all the surgery options for the CA breast. Next. These are the steps of MRM. First is the skill incision. Transverse elliptical skin incision made encircling the nipple and areola and encompassing 5 cm of skin margin around the mass. Next. Second step is raising of the skin flap. Skin flap is raised by sharp dissection. Upper skin flap raised up to the level of clavicle and lower is raised up to the upper quadrant of rectus sheath. Bleeding points coagulated with dithermy. Next. Raising the breast. Breast dissected from fascia covering pectoralis major and whole breast is lifted off from pectoralis major fascia. Next. Axillary dissection. Lateral border of pectoralis major is cleared and all the loose areolar tissue and level 1 lymph node in the axilla cleared, taking care not to injure axillary vessels and nerves. Pectoralis minor muscle dissected and divided. Level 1, level 2 and level 3 lymph node dissected. Lateral dissection up to anterior border of latissimus dorsi. No attempt is made to clear structures above the vein. Separated structures dissected away from chest wall by dissection using a peanut swab. Nerve to serratus anterior identified and preserved. Nerve to latissimus dorsi identified and preserved. And intercostobrachial nerve is dissected and preserved. Next. Closure. Suction drain is inserted. One tube kept in axilla and another underneath the breast flap. Skin incision closed. Subcuticular sutures. Interrupted silk or nylon sutures. After skin closure, vacuum drain is activated. Fluid is squeezed out from the beneath the skin flap and skin flap adheres to chest wall. Next. Thank you.
Thank you, Doctor. Now I invite Dr. Sachin Bhausaheb. I invite Dr. Sachin.
Dr. Sachin, are you there?
So next I invite Dr. Satwa Eknath. I invite
Dr. Satwa Eknath Darade, are you there? Hello, Dr. Satwa Eknath Darade, are you there? Okay, next I invite Dr. Vidya Jayavan Varkude for the presentation. Dr. Vidya, are you there? Okay, doctor, please share the screen.
Yes, sir. Sir, there's a problem in sharing the screen. Will you please share my PPT?
Okay, doctor, I'll share for you.
Yes.
Just a moment, doctor.
Yes.
Dr. Vidya, please start the session, doctor.
Yes, sir. Good evening, everyone. Myself, Dr. Vidya Jayavant Varkute, PG Scholar, Department of Shalya Tantra from SMBT Ayurvedic Medical College. To my today's topic of presentation is Siravedhan, Ayurvedic method of bloodletting review under the guidance of Dr. Shilpa Bade. Next slide, please. Abstract. Siravedhan is one of the method of bloodletting, is a parasurgical procedure directed in treatment of especially Raktas Roga and various surgical diseases. According to the there are many types of bloodletting methods. Example, vein punishment, application of clarification, that is Agnikarma, etc. Siravedhan may be performed on the basis of experience and discretion in all those diseases which are curable by Rakta motion. Next slide, please. Introduction. Ayurvedic therapy is based on two main principles, that is shaman. One is direct elimination of the associated the motion definition Sira. According to Charak, that is vessels with blood from one place to another. It expresses in the body, and from there it returns back to heart vessel. So Sira called as Prabhav because they spread through body, originating with it. Next slide, please. Portion of according to you combine the egg into muscle tissue and divide the muscle into tissue from unconscious portion of meda both sides. Next slide, please. Structure of Sira. By this Sira, entire body is not constantly to extend. Nabhi is their moon, and from there the moon Sira connected to red. There are total 700 Sira in human body. There are 400 Sira in Shaka, 136 in Kushta, and 164 in head and neck. Out of which 602 are Vedya Sira and 98 are Avedya Sira. Next slide, please. Contraindications of Sira. Balyavastha, Garbhavati Stri, Ruksha, the person Viru, Prashant, Parishanta, Madhya Pidit, Stri Karshit. Person was underwent a woman, virechana, astapan, and anvasam. Person who has spent sleepless nights. Next slide, please. Indications of Siravedhan. Here are various diseases according and the site of Siravedhan, which are as follows: Padadaha, Padaharsha, Padadadi, Aubahuka, Chippa, Visarpa, Vatashonit, Vatakantak, Vichachika, where Siravedhan is performed as a distance of 2 fingers above site of Shipramarma with Vrihamukshastra. Kroshtak Shirsha, Khanja, Pangu, where it is performed 4 fingers above the Gulfa Sandhi. Apachi, 2 angul below in the Basti Marma. In Gridrasi and Vishwachi, it is 2 angul above Janu Sandhi. In Galaganda, it is Urumula Sri Sira or in the root of thigh. Next slide, please. Pliha Rog, Yakrudar or Kafudar, middle side of left arm near the Karpur Sandhi or between Kanishtika and Anamika fingers. Social Pravahika, area within 2 fingers around the shoulder. In Parivartika, Upadamsha, Shukradosh, Medra Madhya. In the Kodar, it is 4 fingers below Nabi on the left lateral side of Sevni. Andhra Vidridi and Parshvashul, Sira between Kaksha and Stan on its left side of body. In diseases like Bahu, Shosha, Bahu, Sira wedge should be done between 2 ounces only. Next slide, please. In Trityak Jwar, Siras of Trikasandhi should be punctured. Chaturthak Jwar, Siras below the Ansa Sandhi. Apasmal in middle of Hanusandhi. Unmat, Siras between Shankha and Keshanta or Siras between Apanga and Lalat. Jibha and Dantarog, veins are under surface of tongue. Talu Rog, Talu Sira should be punctured. Gandha Agrahan of Nasa Rog, Siravedhan of Nasa Sira is done. Karnashul, Siras above and near the ear should be punctured. Timir Rog or Netra Rog, Siras near the nose, forehead and outer canthus should be punctured. Siravedhan Vidhi, patient who has undergone the process of Snehan and Svedhan and one who has taken liquid diet or Yavakupan. Patient is made to sit or lie down in a position. Part chosen for puncture should not be tied too hard, not too loose by any cloth. Skin are the inner fibers of the bark or creepers. Sira should be open with proper instruments. Next slide, please. Siravedhan timings. Siravedhan should not be performed on too cold, too hot, wind or cloudy days. Yogya Kal is generally Pitta dosha is vitiated in Sharad Ritu and Rakta vitiation is induced by Pitta provocation. So Rakta mokshan should be carried out in autumn. Next slide, please. Praman. As Rakta Dhatu is very important for life, Acharya Shushruta has decided the quantity of bloodletting for Rakta mokshan. According to Acharya, one prasth, that is 640 ml, is prescribed as maximum volume of bloodletting per setting. Next slide, please. Conclusion. Siraved is one of initial line of treatment in management of Shuf, Vedana, Aruja, etc. Siravedhan is used in Sarvadehi Krishti of dosha, that means vitiation of dosha all over the body. In Shalyatantra, Siravedhan has played very important role in management of Shakhagat Rog, but Siravedhan has played main role in the management of disease caused by vitiation of Pitta and Raktadushti Vikar. Therefore, Siravedhan is called as Ardhachikitsa in Shalyatantra. Next slide, please. These are the few references. Thank you.
Thank you, Doctor. Next, I invite Dr. Komal Sanjay.
Good evening, ma'am.
I invite Dr. Komal Sanjay.
Good evening, doctor.
Can you share my PPT, please?
Okay, doctor, 1 second.
Okay.
Doctor, please the session, doctor.
Okay, sir. Good evening, everyone. Myself, Dr. Komal Sanjay Dange. Today, I am presenting the topic Ashtavid Shastra Karma in surgical practice. Next slide. Introduction. Sushrut was ancient Indian surgeon, has written Sushrut Samhita with aiming to deal different surgical conditions and to remove factors responsible for producing pain or misery from the body or mind. Acharya Sushrut had been performed surgery in India and to admirable heights. The era was later on regarded as the golden age of surgery to obtain better results in all types of surgical procedures. In Shalya Chikitsa, Sushrut has performed 3 different karmas, that is Purva Karma, Pradhan Karma and Pashat Karma. In Pradhan Karma, Acharya Sushrut explains about 8 different surgical procedures under the topic called Ashtavid Shastra Karma. In addition to these, he is also explaining Yogya Sutriyam, that is understanding the surgical procedures with practical knowledge. The recent advanced techniques are also developing based on the Ashtavid Shastra Karma. Next slide, please. Shastra Karma according to different acharyas. According to Sushrut, Patan, Vyadhan, Chedan, Lekhan, Vistravan and Sivan. According to Sushrut, 8 types of Shastra Karma: Chedan, Vedan, Lekhan, Vyadhan, Eshan, Aharan, Vistravan and Sivan. According to Vagbhat, 8 Sushrutas and Utpatan, Putan, Manthan, Grahan, and Dahan. Next slide, please. Shastra Karma and his modern correlation and Shastras used in this study. Vedan, modern, according to modern correlation, excision or ectomy. Shastras used in Chetan Karma. Mandalagra, Karapatra, Vidhipatra, Nakashastra, Mudrika, Utpalpatra, and Ardhadhara. Next is Vedan. Modern correlation is incision and Shastras. Vruddhipatra, Nakashastra, Mudrika, Utpalpatra, and Ardhadhara. Lekhan Karma means scrapping and Shastra. Mandalagra, Karapatra. Vedhan means puncturing and Shastras used in Vedhan Karma. Kutarika, Vrihimuk, Ara, Vetaspatra, and Suchi. Asian Karma means probing and Shastra used in Asian Karma is Ashni. Aharan means extraction and Shastra, Badish, and Dantakush. Vistravan means draining. Shastra, Suchi, Pushapatra, Adhimukh, Shararimukh, Antarmukh, and Trikurchak. Sivan means suturing and Shastra used in Sivan Karma, Suchi. Next slide, please. Chedan Karma, it involves excision of part from the body with the help of Shastra like Mandalagra Karapatra, Vruddhipatra, Mudrika, and Utpalpatra. Anushastra used in Chedan Karma are Spatika, Kaj, Agni, Kshar, and Nakha. Indications of Chedan Karma: Bhagandar, Kafa Granthi, Charmakil, Asthi, Mansagat, Shalya, scalpel, scissors, etc. are modern instruments used in this purpose. Next slide, please. Vedan Karma, it is defined as incision to lay open a cavity for draining out tissue, debris, blood, pus, and waste discharge with the help of Shastra like Vruddhipatra, Nakashastra, Mudrika, Utpalpatra, and Ardhadhara. Anushastra used in Vedan Karma are Spatika, Kaj, Agni, Kshar, Nakha. Indications of Vedan Karma: all types of Vidrati except Sannipatash, Vatash, Pittash, and Kafash Granthi, Vatash, Pittash, and Kafash Visarpa, Stana Rog, Show, Prameha Pidika, allergy, Kshudra Rogas. Vedan Karma is also indicated in deep or superficially seated abscess pocket of pus in fistula or sinus tract. Next slide. Lekhan Karma. Lekhan Karma is performed to scrap out of debris from the affected part with the help of Sushrut like Mandalagra Karapatra. Anushastra used in Lekhan Karma are Kshar, Gojiva, Shefalika, and Nakha. Indications of Lekhan Karma: Vatash, Pittash, Kafash, and Sannipatash, Rohini, Kilas, Medash Granthi, Adhijivika, Arsha, Mandal, Mandal Kushta, and Mansonnoti. Acharya Sushrut has explained certain parameters to assess proper and improper Lekhan Karma. Abscess of bleeding from the side, itching, edema, and appearance of lead like fingernail are characteristic features of Samyak Lekhan Karma. Next slide. Vedan Karma. Vedan Karma means puncturing. By this technique, affected part of punctured with the help of Utarika, Vrihimukh, Ara, Vetaspatra, and Suchi. Anushastra used for Vedan Karma is Karir. Indications of Vedan Karma: Siravedhan, and to remove the fluids from any cavity like Mutra, Vriddhi, Dakodar. Next slide. Asian Karma. It involves snooping of waste discharge, debris, and foreign body, etc. with the help of Ashni from affected body parts and Anushastra used in Ashni Karma are Karir, Bal, Anguli. Indications of Asian Karma: Nadi, Vran, Sashalya Vran, Unmargi Vran. Next slide. Aharan Karma. It involves extraction of waste from the deceased body part with the help of Badisha and Dantashanku. Shastra and Anushastra used for Aharan Karma and Nakha and Anguli. Indications of Aharan Karma: Gandamala, Ashmari, Shalya, and Muda Gharba. Next slide. Visravan Karma. In this procedure, bloodletting and drainage of pus is done with the help of Suchi, Kusha, Patra, Atimukh, Sharari, Antramukh, and Trikurchak. Anushastra used for the purpose of Visravan are Jaloka and Nakha. Indications of Visravan Karma: 5 types of Vidrati, Ek Deshat Shok, Slipad, Vishad Shok, Shonit, all kinds of Arbud, all kinds of Visarpa, Vatash, Pittach, Kafash, Granthi, वातज पित्तज कफज उपदंश स्तन रोग विदारिका क्षुद्र रोग. Sivan karma. It is a technique to appropriate the insides and exercise by using suitable suturing methods, needles and threads as post-operative management. Suchi. The Ruju Granthi, Anuvelit, Bofanica, and Tuna Seveni are various types of Sivan used in this therapy. Indication of Sivan karma. Sadhya Vran, Sulekhit Vran, disease. Next. Ashtavi Shastra Karma in the management of various diseases. Chedan Karma with Tapta Shastra is used in Sadhavran. Bedan Karma and Aharan with the help of Ashmari. Bedan with Sivan Karma used in Baddha Gudodar. Vistravan with Nadiuran used in Jaladhar. Vistravan used in Pakva Vidradi. Rakta Vistravan Karma in Visarpa. Bedan Karma Vidradi. Lekhan Karma, Upajivika and Danta Vaidarbha. Conclusion. In the field of surgery, Ayurvedic Shalya Chikitsa offers great contribution. Surgical instruments by Sushrut for each Shastra Karma are almost similar to modern surgical instruments. Ashtavi Shastra Karma have been explained in details and these principles are well explained in modern surgical era. These techniques are used either alone or in combination in surgical practice. Thank you.
Thank you, Dr. Komal. Now I invite Dr. Sapna Sodhani.
Good evening, ma'am.
I invite Dr. Sapna.
Good evening, ma'am.
Good evening, doctor.
Can you please share my PPT?
Okay, just a moment, doctor. I'll share for you.
Thank you, sir.
Doctor, please start the session, doctor.
Yes. Myself, Vaidya Sapna Sodhani, second year Kai Chikitsa, Adepuddar Ayurved Medical College, Valli, Mumbai. Title of presentation: Management of Mukhadushika, Acne vulgaris with Ayurvedic intervention, a case study. Acne vulgaris is a chronic inflammatory condition of skin in youth. In Ayurveda, acne has been elaborated as one of the Shuddha rogs. In modern era, this is a burning problem in the adolescent symptoms of a Mukhadushika show close resemblance with bacterial infection and inflammatory factor of acne. In Ayurveda, it can be correlated with Mukhadushika. Whited of cough dosh, vat dosh, and rakta dhatu lead to development of Mukhadushika. Next slide. Selected case: a 23 years old college girl came to Podar Hospital Medicine OPD with pustule, pigmentation, inflammation, and mild screening over face selection criteria. Duration 7 months. Earlier, doctor dermatologists have diagnosed acne vulgaris. No comorbidity, no past history, no history of addiction, normal appetite, motion, urine. Bowel and bladder movements are normal. Vital signs are normal. Investigations show mild anemia, that is iron deficiency anemia. Next slide. Next slide. So these are the lesions before treatment pictures. Need and scope of study. It is celebrated topic in dermatology and it's not only harming physical but mental and social too. Hence, it is a matter of concern. I have seen college going students literally going into depression, trying out all the possible ways to treat acne. So to treat with maintaining the acidic value is very important. Next slide, sir. Let us understand the pathology first. The multifaceted and at least 4 factors have been identified. These key elements are follicular epidermal hypoproliferation, very interesting. Sebum production, the main component of sebum, triglyceride, is important in acne pathogenesis. Triglycerides are broken down into free fatty acid by P. acnes normal flora of the pilosebaceous unit. In return, this free fatty acid promote P. acnes colonization and induction of inflammation. Propionibacterium acnes gram-positive anaerobic microaerobic bacterium found in the sebaceous follicle. Inflammation and immune response. Next slide, sir. You can see here that is acne is one of the top three most common skin diseases, particularly in adolescents and young adults, in whom the prevalence is estimated at 85%. Age is 12 to 25 years. Next slide, sir. What Ayurveda says. According to Acharya Sushrut, vitation of curve dosh, vatosh, and rakta dhatu leads to the formation of acne. Acharya Kashyap mentioned that Shukra dhatu, that is semen, development occurs in the young age and there is a change in sexual character along with the formation of acne. In Sharanga Samhita, it has been mentioned that acne is caused due to the Shukra dhatu mal, waste product of semen. In Yuvan Pidika, vitation dosh, dhatu, and mal, basic bioelements get accumulated in strotas, causing blockage and leads to the Pidika formation. Next slide, sir. Assessment criteria and results. Mild acne, less than 20 comedons, less than 15 inflammatory lesions or total lesions count are less than 30. Moderate acne, 20 to 100 comedons, 15 to 50 inflammatory lesions or total lesions count is 30 to 125. Severe acne, less more than 5 pseudocytes, total comedon count is more than 100, total inflammatory count is more than 50. A total lesions count is more than 125. My case falls under mild acne and it responds well with decreasing the comedons and inflammatory lesions and screening. Next slide, so. Material and matters. Aragadanvati, 2 tablets TDS after meal. Triphala Kugul, 2 tablets after meal. Mahamanjeshwari cord, 20 ml BD before meal. And Jaloka Auchadan, once weekly for 4 weeks. Next slide, so. Pathya Pathya. Patient was advised to avoid oily, fried, spicy, junk, heavy food, including curd, milk, and non-vegetarian diet. Maintenance of local hygiene by washing the parts twice a day. Daytime sleep was advised to be avoided. Next slide. Pathophysiological break. Mahamanjishta cord. It contains Manjishta, Mushta, Kutaj, Guruchi, Nagar, Kushta, Barangi, Vacha, Nimba, Traymanchitra, Viranga, Shatavadi, Vasa, Pathya, Varun, Bakuchi, Karanj, or etc. It is a Rakta Shodak, Tocha, and Kushtagna. It has effective Rakta Prasadan action. Triphala Google, it works wondrously as a blood cleanser and helps in soothing acne, helps remove toxins from the body. Aragya is one of the most effective Ayurvedic preparation which helps to manage acne or pimples due to its pitta and kapha balancing and Shrutahar anti-inflammatory properties. It also helps in blood purification by removing toxins due to its Shodhan detoxification property. Ayurveda believes in treating the root cause by Shodhan Chikitsa. Rakta Mokshan removes the vitation blood and clears the Strotas Avrodh blockage in channel, thus breaking the Samprapti pathogenesis. Next slide, sir. I got this wonderful treatment with a wonderful smile in 4 weeks of treatment. Next slide, so. Conclusion. With the present case study, I want to tell you all that procedure mentioned in Ayurveda works beautifully when used wisely with proper assessment of the skin lesion you're treating. Next slide, so. These are the references. Thank you.
Thank you, doctor. Next, let me invite Dr. Prajakta. I invite Dr. Prajakta Chandrakant.
Hello, Dr.
Dr.
Prajakta, are you there? Okay, next I invite Dr. Kabil Satish Mahajan for the paper presentation. Dr. Kabil Mahajan, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Sir, can you please share it for me?
Okay, just a moment, doctor.
Yes, sir.
Please start the session, doctor.
Yes, sir. Good evening, everyone. Myself, Dr. Kapil Satish Mahajan, PG scholar from SMBT Ayurveda College, Nashik. Today's my topic is role of sterilization in surgical practices. Next slide, please, sir. Introduction. Sushruta is known as father of surgery. Sushruta Samhita is considered as golden book for all surgeons, and every medical practitioner, as it contains every detailed information like years ago, is used today. Nasal reconstructions, plastic surgery, cataract surgery, etc. are firstly mentioned in Sushruta Samhita. Agnikarma, Kshar Karma, Raktamokshan, etc. are given by Sushruta to world. Samhita contains 120 chapters, among which every chapter gives us detailed explanation in every word. Next slide, please, sir. Sterilization, as per Ayurveda, Nirjantikikaran is equivalent term for sterilization. No direct reference is available for this. Scattered references gives the idea of aseptic approach to yantra and shastrakarma. Prior to surgical procedure, preparations of patient, surgeon by removing hairs, cutting off nails, wearing clean and washed clothes have been advocated. References of Nirjantukikarana, Dhupan Vidhi, exposure of part or the article by Dhuma or Krumigna drugs. Vrana Dhupana prevents affiliations of krimis and rakshasas. Dhupan dravas are as follows: Gugul, Agru, Sarpash, Vacha, Nimbupatra, Sarjaras, Lavana, Kruta, etc. Dhupana has to be given 2 times a day. Dhupan Vidhi has been mentioned for Bandha Dravyas, patient dresses, beddings, and also for Shastragara and Pranitagara. Next slide, please, sir. And sterilization, as per modern common definition, sepsis. Presence of pathogenic microorganisms or their toxic products in the tissue of an patient. Asepsis, the absence of pathogenic microorganisms in living tissue. Aseptic techniques, the clean practice used to remove or destroy pathogens and to prevent their spread from one animal, people, or place to another animal, people, or place. Antisepsis, prevention of sepsis by destruction or inhibition of microorganisms using an agent that may be safely applied to living tissues. Antiseptic is a chemical agent that either kills pathogenic microorganisms or inhibits their growth on inanimate, that is living tissue. Disinfectant, a germicidal chemical substance that kills microorganisms on an inanimate objects. Disinfection, removal of microorganism, but not necessarily their spores, viruses found on non-living objects. Sterilization, complete elimination of microbial viability, including vegetative forms of bacteria and spores by physical or chemical means. Next slide, please, sir. Sources of contamination. Transmission of microorganisms. Microorganisms are transmitted by hospital staff, environment, contaminated instruments, surgical personnel, non-sterile barriers, surgical clothing, that is scrubs, tops, surgical head covers, face masks. Sterile barriers include gloves, surgical skin scrub, patient, operate out OT environment, surgical equipments. Next slide, please, sir. Principles of surgery asepsis. There are several principles of surgical asepsis. First, use only sterile items within a sterile field. Scrub personally as are gowned and gloved. Sterile personally operate within a sterile field. That is, sterile personally touch only sterile items or areas. Unsterile personally touch only unsterile items or areas in an OT. Sterile drapes are used to create sterile field. All items used in sterile field must be sterile. All items introduced into sterile field should be opened, dispensed, and transferred by method that maintains sterility and integrity. A sterile field should be maintained and monitored constantly. Surgical staff should be trained to recognize when they have broken technique and should know how to remedy this situation. Next slide, please, sir. Types of sterilization. There are several methods of sterilization which include physical method, chemical method, gas sterilization, and eradication. Physical method include dry heat, moist heat. Chemical sterilization includes alcohol, aldehyde compounds. Gas sterilization include ethylene oxide, and eradication includes ionizing and non-ionizing eradications. Next slide, please, sir. Summary. Sterilization is a process of killing all microorganisms in an vegetative or spore state. The factors that determine the type of sterilization or disinfection process to be used, including time, temperature, stage of growth of organism, nature of medium of organism, that is air, gas, liquid, and the number of organisms present. Sterilization and disinfection can be achieved by using heat, filtration, chemical, or radiations. Overall, heat is the best means of sterilization, but other methods are used for heat liable objects. Dry heat requires more time than we heat to kill organisms. Boiling kills most vegetative cells, but not bacterial spores. And pressure cookers and autoclaves achieve sterilization. Next slide, please, sir. Conclusion. Sterilization is an important procedure. Sterilization has major share in success of surgical management. No elaboration description is available in Ayurvedic states. Hints are given to perform surgeries under aseptic precautions. Dhupan dravyas are used to be studied for their krimigna properties. An attempt to evolve Ayurvedic sterilization procedure is absolute necessity. Next slide, please, sir. References. There are various references I are used for this PPT. That is research papers, online articles, magazines, and last one. Thank you.
Thank you, Dr. Kapil. Now I invite Dr. Snehal Navnath.
Yes, ma'am.
Hello, doctor. Can you please share the
Yes, ma'am.
screen, doctor?
Can you please share the screen for me?
Okay, just a moment, doctor. Please start the session, doctor.
Yes. Good evening, all. Myself, Dr. Snehal Navnath from Department of Chikiत्सा at GSS Nanded, guided with Narkandi sir. My topic of presentation is rheumatoid arthritis, AMVAT, a case study. Next. Here are some contents: introduction, aims and objective, material and method, result, discussion and conclusion. Next. Rheumatoid arthritis, it is an autoimmune chronic inflammatory disorder. As the disease progresses, the inflamed synovium invade and damage the cartilage and bone of the joint. According to Ayurveda, it can be correlated with Amvat, in which vitiated Vat dosha carries arm to the multiple organ and joints, causing swelling, pain, stiffness, loss of appetite, that is, decrease the Agni. In Ayurveda, Rukshan Chikitsa mainly stated in Amvat. It includes Langan, Svedan, Basti Chikitsa. Aims are to study the Ayurvedic management in rheumatoid arthritis, and objectives are to reduce the morning stiffness, pain, swelling, and loss of appetite. Next slide, please. Here is the case report. A female patient of age 34-year-old came at the OPD of Kai Chikitsa. Her chief complaints are pain and swelling at both the wrist joint, shoulder joint with morning stiffness and loss of appetite, mild feverish occasionally since 5 years. Next slide. Her history said no history of diabetes, chikungunya. She has history of chikungunya since 4 years. Her fever persists for continuous 1 year. RX taken from private hospital 1 year ago. She is current medicine is tablet Folitrax 7.5 mg once a week for 6 months with tablet Folvite 1 OD for 6 months. Next. Personal history of patient is diet is mixed, appetite is good, bowel incomplete evacuation, that is once per day, micturition normal, sleep disturbed due to pain, addiction none, menstrual history is regular, and occupation is housewife. Next. रुग्ण परीक्षा नाडी 86 per minute, मल असम्यक, मूत्र सम्यक, जिह्वा साम, शब्द स्पष्ट, स्पर्श अनुष्ण शीत, दृक, प्राकृत, आकृति मध्यम, अग्नि मांद्य, and nidra खंडित. Next. On examination, GC moderate of April, BP 110/70, pulse 88, RS air entry bilateral equal and clear, CVS S1 S2 normal, CNS conscious oriented, investigation RA factor 31.40 and ESR 1 year ago is 60. Other factors are normal. Next. संप्राप्ति घटक दोष वात where van and samanvayu, pitta pachak pitta and kapha shleshak kapha, dushar rasa rakta meda srotasa rasava raktava purishva, rog marga madhyam marga, udbhav sthan ama pakvashe, agni is mandya, adhishtan ubhay manibandha and ansa sandhi and sadhya sadhyatva kashta sadhya. Next. निदान पंजक हेतु ऑफ रुग्ण इज मधुर रस सेवन, स्निग्ध आहार सेवन, एक्सेसिव इंटेक ऑफ मिल्क प्रोडक्ट, राइस, लैक ऑफ एक्सरसाइज, परिवर्तित आहार, दिवास्वप, मांसाहार, विषमासन एंड स्ट्रेस. पूर्व रूप ऑफ patient is mild pain and swelling in both wrist joint. Rupa, pain and swelling at both wrist joint, shoulder joint with morning stiffness and loss of appetite and sometimes mild feverish occasionally. Upashay is getting by hot fermentation. Next. संप्राप्ति हेतु सेवन, देन आम संचिति, कफ पित्त वात एंड आम दुष्टि, देन सामदोष धमनी प्रतिपद्यते, वायुना प्रेरितो आमम श्लेष्म स्थान प्रधावति, देन स्त्रोतसास्य अभिसंध्यति, देन आमवत. Next. Treatment given is Langan with Mudga use for 7 days, then Svedhan with Valuka Potali for affected joint for 7 days, then Vaitran Basti for 15 days with Gomutra, then Matra Basti with Guduchi and Sunti Siddha Tel for 7 days, Tribhuvan Kirti Rasa for 1 BD with lukewarm water before meal for 1 month, and Sihanath Gugu 2 BD after food with lukewarm water for 13 days, then Eranda Brushta Haritaki for HS 1 for 13 days, local application lep with Devdaru, Punarnava, Sunti, Kuduchi Churna with Gomutra for both wrist joint for 13 days. Next. Here are some results and assessment. RA factor before treatment is 31.40 and after treatment become 18. ESR before treatment is 16 and after treatment become 13. Changes of signs and symptoms are before treatment swelling is 3+, pain is 3+, and after treatment 1+, stiffness is 3+, after treatment 2+, loss of appetite before treatment is 2+, after treatment 1+, temperature before treatment is 3+, and after treatment 1+. Next. Next slide, please. Discussion. As the case discussed was a case of Amvat, mainly Vat dosha where Vikrut and Agnimandya is present. About treatment of Am, mainly Rukshan Chikitsa, include Vaitran Basti with Nadi Svedhan and Lepa. Valokapotali Svedhan was in present case study, combined use of Vaitran Basti. Amvat can be successfully managed with Ayurvedic Rukshan Chikitsa. In present case study, combined use of Vaitran Basti and Eranda Sneha gave remarkable relief to the patient with significant reduction in morning stiffness, also the pain and swelling of both the wrist joint. Patient was advised to follow Patyakar Ahar and Vihar. Next. Thank you.
Hello, doctor. Hello. Hi, doctor. Actually, how many days of treatment you had given for the patient?
30 days.
30 days. And what's the amount of Eranda Brushta Haridhaki you had given?
1 tablet for HS.
Actually, as a tablet you had made.
Yes.
First you had done that fried that Haridhaki in Eranda Taila, and you had make pills for that, right?
Yes, there is a ready-made tablet available in market.
Okay. And what's the weight of that tablet?
250 mg.
250 mg. Only 1 tablet you had given daily.
Yes.
Okay. Thank you.
Thank you, doctor. Next, I invite Dr. Megha Suresh for the paper presentation. Dr. Megha, are you there? Hello, Dr. Megha, are you there? Okay, next I invite Dr. Abeksha
Hello.
Prakash Pava for the paper presentation. Hello, Dr. Abeksha.
Hello, sir. Dr. Megha here.
Okay, Dr. Megha. Can you please share the screen, doctor?
Yes, sir.
Okay,
Can you please share my PPT, please?
doctor, just a moment. Megha, please start the session, doctor.
Yes, thank you, sir. Myself, Dr. Megha Suroshe, PG Scholar, Department of Kaya Chikitsa, guided by Dr. Gupte, sir, Associate Professor of Department of Kaya Chikitsa. Next slide. Here, the content is introduction, aim, objective, material, method, result, discussion, and conclusion. Next, introduction. Avian is a here is a case study of Ayurvedic management of avascular necrosis. Introduction. Avian is a osteonecrosis and also called ischemic bone disease. It can be seen in 3 to 40% of patients receiving corticosteroid therapy. It generally affects the people between the age of 30 to 50 years. The arteries supplying to the femoral head are very narrow and hence easily liable to the injury, followed by the more dislocation or a subcapital fracture of femoral neck. This leads to the lack of nourishment to the femoral head, resulting in the necrosis. Next, please. This stage can be corresponding with the astikshaya as per sign and symptom described in Ayurveda. From the dhatus asti does the function of sharir dharana. Hence, it is asti which gives the proper shape to our body and it also protects the vital organs. Asti dhatu is the main site of vata dosha. Whenever vata dosha accumulates, asti dhatu dissipates because vata dosha and asti are conversely proportional to each other as per the principle of ashray bhava. Next, please. Aim and objective. Aim to study the Ayurvedic management in the avascular necrosis. Objective to study the avascular necrosis or to study the Ayurvedic management of vata rakta. Next, please. Material and method. Here a case study with a patient having the age of 30 years. Sex is a male, religion Hindu, address is Nanded. Date of admission is 1/12/2022 or a date of discharge is 30/12/2022. Next, please. Next, chief complaint. The patient having mainly difficulty in walking and associated pain in the groin and in the thigh region for the 1 year. Past history, patient having no history of diabetes mellitus or hypertension, but having COVID-19 positive before 2 years ago, and the bone grafting of a right femur 1 year ago was done. Next, please. Personal history. Diet is a mix, mostly vata prakopak. Appetite is a good. Bowel is complete evacuation. Micturition normal 4 to 5 times per day. Sleep disturbed because of pain. Addiction not. And occupation, he is a lawyer. Next, please. On examination, in avascular necrosis, the range of movement we observe, that is the flexion of right leg before treatment, it is a 70, and left leg is 100. Extension is a 10, 20. Abduction is a 15, 30. Adduction is a 10, 35. Internal rotation 15, 20. External rotation is a 10 and 25. Next, please. रुग्ण परीक्षा. नाडी 74 per minute. मलय सम्यक, मूत्र सम्यक, जिह्वा निराम, शब्द स्पष्ट, स्पर्श अनुष्ण शीत, दृक स्पष्ट, आकृती is मध्यम. Next. प्रकृती is वात प्रधान पित्त और मानस प्रकृती is राजस. सार मध्यम, रस रक्त मांस, सहन मध्यम, प्रमाण weight is 40 kg and height is 5.3 feet. सात्म्य मध्यम, आहार शक्ति, अभ्यवरण और जरण शक्ति 5 to 6 hours. व्यायाम शक्ति अवर, वय युवा अवस्था and देश is साधारण. Next. संप्राप्ति घटक.
दोष मेनली वात, दृश्य रक्त शिरा स्नायू अस्थि, अधिष्ठान पक्वाशय, स्थान संश्रय, वंशन pradesh, samprapti, due to lack of blood supply to the head of the femur and hip joint, due to indulgence, vata provoking food and habit, the aggravated vata accumulate in the hip joint, causing further degeneration. Next. The investigation in MRI, the imaging finding with avascular necrosis of both the femoral head with the facet and arterial stages, second and third on the right and second on left side, more severe on right side. The other investigation SB is normal, that is 14.2, WBC 77, platelets 2 lakh, BSL random is 19.6. Next. LFT is normal, that is total bilirubin 0.53, direct 0.11, indirect 0.42, SGOT 16.5, SGPT 21.2, KFT blood urea 22.0, creatine 0.81, bleeding time 1.41, and clotting time 4.55. Next, please. Treatment advice. Both the medical and procedural therapies was administered in the patient. Drugs, that is a tablet tapadiloho, 2 tablets plus rasasindur 125 mg is given with anupana madhu for 1 month. Jvaragna churna also with koshta, rechak, arjun churna each 250 mg was given with lukewarm water 2 times a day. Capsule gugu tiktaka gruta 250 mg given with lukewarm water. Next, please. Then procedural therapies, Snehana with Bala Guduchi Aditela. Then Nadi Sweda with Dashmul Guduchi Vasa Punarnava Yashti Churna along with cow milk. Parikshaka done along with the Guduchi Vasa Yashti Madhu and Nurgandi Churna. Next, please. Tiktakshir Basti and Niruva Basti are given for 1 month with the cycle of 7 Tiktakshir Basti along with 1 Niruha Basti. Tiktakshir Basti contain the Guduchi, Patola, Kirat Tikta, Yashti Madhu Churna, each 1 gram with the cow milk 60 ml, water 100 ml, and Panchatikta Gruta along with it with 20 ml. Then Niruha Basti, the content is Dashmula Kwatha 760 ml plus Madhu 50 gram. Sendhav Lavan 10 gram, Shatapushpa Kalka is 30 gram, and Tila Tela is 50 ml. Next, please. Then the observation, the range of movement of hip joint is significantly improved. After treatment, the right leg flexion is 100, in left leg it is 110, extension 20, 25, abduction is 25, 30, adduction 25, 25, internal rotation 20, 20, 30, external rotation 20, 30. Next, please. Discussion. Vascular necrosis is a death of bone tissue because of interference of blood supply. In early stage, there might no symptoms, but later stage it affects both the bone and nearby structure. Etiology can be traumatic. In this case, there were other factors which reduces bone composition. As there is an involvement of vata and rakta, the treatment given is a vata shamak like basti. The content in the tiktakshir basti mainly act on asti and majja dhatu. Internal medicine and mainly vata shamak. Next, please. Conclusion. As there is no permanent cure for avascular necrosis, core decompression in the initial stage and hip replacement in the later stage are the only options which have its own complications. Here in this case study, the Ayurvedic treatment for the avascular necrosis helps to improve the range of movement of hip joint, and the treatment are non-invasive and cost-effective. Next, please. Thank you.
Thank you, doctor. Next,
Let's
I
invite
invite
Dr.
Dr.
Abhiksha Pava for the presentation. Dr. Abhiksha Prakash Pava, are you there?
Yes, sir.
Doctor,
Can you please share my
share screen?
PPT?
Okay, doctor. Just a moment, doctor. Dr. Abeksha Pawar.
Yes, yes.
Start the session, doctor.
Myself, Vaidya Apeksha Pawar, PG scholar from GSH Nanded, guided me by Vaidya Kulkarni sir. Today's my presentation topic is management of Pakshaghat in Ayurveda with a case study. Next, introduction. Pakshaghat is one of the Vat Vyadhi. Pakshaghat has been linked to hemiplegia, a type of paralysis caused by a cerebrovascular accident or a stroke. It is a loss of brain function due to a disturbance in the blood supply to the brain. The disturbance is due to either ischemia, that is lack of blood flow, or hemorrhage due to hypertensive trauma, rupture aneurysm, drug elicited hemorrhage. Pakshaghat is made up of two words, paksha, that is half part of the body, and aghata, loss of function. The cardinal features of Pakshaghat include cheshtahani, impaired motor activity, ruja, pain, vakastambha, slurring of speech, hastapada sankocha, sandhi-bandhan vimokshana. Patient usually present with loss of function of a half part of a body or weakness of half part. Next, the aim to study the effect of Ayurvedic management in Pakshaghata. Objective to reduce the tingling sensation, numbness, and weakness in the left upper and lower limb. Next, a 20-year-old male patient came to OPD of Kai Chikitsa with complaints of tingling sensation and numbness in left upper and lower limb, weakness in left upper and lower limb, vakaspashtata alpa, and these complaints since 3 months. Patient had known case of hypertension and on regular medication since 3 months, taking tablets CTD, AM1 OD. He was also the history of RTA 1 year ago and also history of typhoid fever 12 years ago. Next, रुग्ण परीक्षा were done. नाडी 86 per minute, मल असम्यक, मूत्र सम्यक, जीवासाम, शब्द अल्प स्पष्ट, स्पर्श was अनुष्ण शीत, द्रिक प्राकृत, आकृति, कृश, अग्निमांद्य, and निद्रा सम्यक. Next, on examination, GC moderate and afebrile, air entry bilateral equal and clear. CVS also S1, S2 are normal. Patient was conscious and oriented. BP 110/70 mm of Hg and pulse rate 86 per minute. CT brain showed subacute intraparenchymal hematoma involving right putamen extending in insular and temporal lobe white matter. Mild mass effect in the form of effacement of right lateral ventricle and midline shift to left side by 5 mm. Next, reflexes examinations were done. There is mild exaggerated reflexes of bicep and tricep on the left side and exaggerated reflexes of knee and ankle on the left side. Plantar reflexes also shows extension. On the other side, the right side reflexes were normal. Next, muscle power examinations also done. The right upper and lower limb shows 5 power, that is movement against full resistance with a normal strength, and the left upper and lower limb shows 3+ grade, that is movement against gravity but no against added resistance. Next, Pakshaghat Samprapti explained by Acharya Charaka. Hatva ekam maruta paksham dakshinam vamamevava kurya chesha nivruti rujam vaka stambhamevacha गृहीत्वा अर्धम शरीरस्य शिरास्नायु विशोषच पादम संकोचयति एकम हस्तं वा तोद शूलकृत एकांगरोगम तम विद्यात सर्वांगम सर्वदेह जम. Acharya Charaka explained that Prakupit Vata making adhishtan in one half of the body, which is associated with Cheshtahani, Ruja, Vakastambha, Hastapada Sankocha, Sandhi Bandhana Vimokshan of that side, present with loss of function or weakness in the half part of the body. Next, treatments given was Snehan with Bala Ashwagandha Lakshadi Taila, Nadi Swet with Dashmur Erandamul Kwatha, Nasya with Anu Taila, 4 drops in each nostrils, Shali Shashtik Pinda Swet were done with Bala Ashwagandha Churna and Godugdha. Next, Dashamul Erandamul Siddha Tel Dhara. Tiktashir Basti was given up to 60 ml in Matra. Guduchi Patol Kira Tikta Yashti Churna Kwatha. After 7 Tiktakshir Basti, 1 Niruha Basti was given. Such a 3 cycles were done, that is 7 Tiktakshir Basti and 1 Niruha Basti. Next. Internal medicines was Masha Atmaguptadi Kvata 20 ml BD before food with lukewarm water for 15 days. Sukshma Yogendra Rasa 125 mg TDS after food with Anupan Madhu. Tapyadi Loha and combination of Tapyadi Loha and Rasa Sindur 625 mg BD after food with lukewarm water for 15 days. Dashamul Haritaki Leha 5 gram BD with lukewarm water was given. Next. Discussion. Snehan is the first line of treatment in Keval Vatajanya Roga. Abhyanga, it's Vata Kapha Shamaka. Nadi Svedhan, Shalishashtik Pinda Swed are some of the Svedhan therapies which are given. All types of Svedhan therapy helps in purification of Vata dosha, which removes the stiffness and heaviness, cleans the strotasas of the body, and improves the blood circulation. Basti Chikitsa is considered to be best treatment modality for Vata dosha. In Tiktakshir Basti, we are using Tikta Dravya and Shira, which having Asti portion and Vata Shaman properties. Shira is considered as main site of Pran and Udan Vayu. So drug administered through nose stimulate the higher centers of brain through olfactory nerve pathway, which is connected to the hypothalamus and limbic system. Hence, the nasal drugs administration will ultimately have an effect on the function of CNS. Next. Conclusions. As Pakshaghat is a Vata Vyadhi, increased Ruksha Guna of Vata increases Rukshata and Parushata in the Strotasas. So as to rectify the Ruksha Guna of Vata, Snehan is performed in the form of Abhyanga, Nasya, Shalishashtik Pindaswet, Basti are quite beneficial. The above mentioned Shaman Aushadhis are helpful in pacification of Vata dosha. Though Pakshaghat is difficult to manage, but early diagnosis, management, and logical use of internal and external medicine helps in obtaining the good result. Next. Thank you.
Thank you, doctor. Next, I invite Dr. Anjuta Prakash.
Hello. Hello, ma'am.
Good evening, doctor. Doctor, please use the screen.
Okay, 1 minute, just for me. Will you please present for me, ma'am?
Yes,
Doctor. Hello, doctor. Please
Hello.
start, doctor.
Hello. Myself, Vaidya Aniruddha Pongshe, PG scholar from Department of Kaya Chikitsa, Government Ayurvedic College, Nanded. Guided by Dr. Pathan SI, Department of Kaya Chikitsa, GSC Nanded. My topic of presentation is management of ITP by Ayurvedic treatment, a case study. The content is introduction, aim and objective, material and method, results, discussion, conclusion and result. Introduction. ITP or immune thrombocytopenic purpura is a disease that represents with low level of platelet count. It is autoimmune pathology which also causes hemorrhagic episodes caused by antiplatelet antibodies. It is characterized by increased platelet destruction and impaired platelet production. Next, please. Platelet formation takes place in bone marrow. In Ayurveda, vitiated doshas in Astimajja Dhatu are being mitigated with the help of Chaturthak Jwarashamak Kashaya which is well known as Asthi-Majja Pachak Kashaya. Vatagna treatment is also useful for Asthi-Majjagat diseases. Next, please. Aim and objective. The aim is to study the Ayurvedic management in immune thrombocytopenic purpura or ITP. Objective is to study immune thrombocytopenic purpura. Second, to study Ayurvedic management of Asthi-Majjagat Vyadhi. Next, please. Material and method. Case report. A female patient of age 47 years old came to the OPD of Kai Chikitsa. Chief complaints were patient had complaints of Brahma, giddiness, Shirogaura, headache, Pindico-Western, calf muscle pain since last 1 year. Next, please. History. Patient had no known case of diabetes mellitus or hypertension, no history of trauma and fall. Patient had history of same complaints, that is diminished platelet count 1 year ago, for which patient had undergone platelet transfusion. No history of any addiction. Next, please. Personal history. Diet was mixed, mostly Vata Prakopak Ahar. Appetite was good. Bowel incomplete evacuation, 1 motion per day. Micturition normal 4 to 5 times a day. Sleep disturbed because of pain. Addiction none. Menstrual history was regular. Occupation was housewife. Next, please. Rugna Pariksha. Nadi was 78 per minute. Mala was asamyak. Mutra was samyak. Jiva was sama. Shabda was spashta. Sparsha was anushnashit. Ruksha. Drushti was prakrut. Akruti was madhyam. Agni was sama. Nidra was khandit. Next, please. On examination, general condition was moderate or febrile. BP was 120 by 70 millimeter of Hg. Pulse rate was 78 per minute. In RS systemic examination, RS was clear. CVS examination was normal. CNS examination was normal. Investigations before treatment. Hemoglobin was 11.9 gram percent. Platelet count was 38,000 per cubic millimeter. Next, please. Samprapti Ghatak. Dosha is Vat, Apan Vayu and Man Vayu. Dushya is Asthi Majja Dhatu. Srotas is Asthi Va Srotas and Majja Va Srotas. Rogamarga is Madhyam Rogamarga. Agni is Samagni. Sadhya Sadhyatva Krucha Sadhya. Next, please. Nidan Panchak. Hetu was Vatal Ahar Sevan, Chinta, Jagran. Purvarupa was Sarvanga Marda, mild. Rupa was Brahma Prachiti, Shiro Gaurav, Pindico Dveshtan and Sarvanga Marda. Upashaya by Vatagna Chikitsa. Next, please. Samprapti is Vatal Ahar Sevan, then Vata Prakop, which caused Vata and Asti Ashraya Ashray Sambandha, which caused Asti and Majja Dhatugat Vata Prakop. Next, please. Treatment given was Lasun Kshirpak 20 ml BD, Asthi Majja Pachak Vati 500 mg TDS. Both the medicines were given for 10 days. Next, please. Results and assessment. Before treatment, the platelet count was 38,000. After 10 days of treatment, platelet count was 49,000. HB was 11.9 gram, which was after treatment 12 grams. Next, please. Discussion. Immune thrombocytopenic purpura is an autoimmune disorder which has complex treatment in modern medicines like platelet transfusion or splenectomy. ITP has bone marrow suppression which can be corrected with Asthi Majjagat Vatvedi. Lasun Kshirpak is used for treatment of vitiated Vata for its Vatagna action. Asthi Majja Pachak Kashaya has ability to suppress Vata vitiated in Asthi Majja Dhatu. Next, please. Conclusion. Thus, it can be concluded that ITP or immune thrombocytic purpura can be compared with Asthi Majjagat Vata and treatment can be done accordingly. Further study must be carried out to see the efficacy of the treatment. Next, please. Thank you.
Thank you, doctor. Next, I invite Dr. Rupali Keshav Rao. I invite Dr. Rupali Keshav Rao. Dr. Rupali.
थोड़ा कुछ ऐसे होगा तो क्या करेंगे?
Dr.
नहीं, 7 ही
Rupali.
लोग हैं, 1 2 3 लोग हैं, मैं 4.
Hello, Dr. Rubali, are you there?
I invite Dr. Madhuri Giri. Dr. Madhuri Giri.
Hello, can you hear me?
Yes, doctor. Is it Dr. Madhuri?
Yes, doctor.
Hello.
Dr.
Is it
Madhuri.
Dr. Madhuri Giri?
Hello. Yes, I'm here. Hello. Can you
Doctor,
hear me?
you can hear, doctor.
Hello.
Audible, doctor.
Hello, can you hear me? Here, Madhuri Giri.
Yes, doctor, we can
Yes, doctor.
hear you.
Yes, doctor, you are audible, doctor. Dr. Madhuri, you are audible, doctor. Can you please share the screen, doctor? Dr. Madhuri Giri, please unmute, doctor. You are audible.
Hello, sir. Can you speak? Please share my PPT.
Okay, I will share for you, doctor. 1 second. Dr. Madhuri, please start
Yes.
this, doctor.
Hello.
You are audible, doctor. Please chat.
Oh. 1 minute. Hello. Hello.
Dr. Madhuri, you are audible,
Yes.
doctor. If the
Yes.
screen is visible,
My
please chat, doctor.
yes. My topic is plantar fasciitis and its Ayurvedic management, presented by Dr. Madhuri Giri, PG scholar, Kriya Shari Department, GSC Usmanabad, guided by Dr. R.S. Dimdime, HOD and Professor Kriya Shari Department, GSC Usmanabad. Next, introduction. What is plantar fascia? Plantar fascia is thick connective tissue supporting to the arch of the bottom of foot. It runs from the tuberosity of the calcaneus forward to the head of the metatarsal bone. Function of plantar fascia, support of the arch of the foot, dynamic function during gain. Next slide. Next slide, please. What is plantar fasciitis? Itis means inflammation. It is a painful foot condition caused by inflammation of insertion of plantar fascia on the medial process of calcaneal tuberosity. These are the basic symptoms seen in the plantar fasciitis: pain, swelling, warmth of the affected area, redness of adjacent skin. Risk factor: foot arch, obesity or sudden weight gain, long distance running, tight ankle tendons, shoes with poor arch support or soft soles. Next slide, please. Case study. The patient named Mr. Sheetal Wagmare, age 37 years, male patient. History: the patient jumped on uneven surface from 8 to 10 feet height. Then he feels severe pain in right ankle joint, pain and tenderness. Then he take orthopedic opinion and he admitted for 7 days, and he took anti-analgesic, anti-inflammatory and multivitamin tablets. After 7 days, he got discharged, but he had no relief. Then he took another orthopedic opinion and he used cast for 15 days. Then after 1 month, the duration between fall and the treatment in government Ayurvedic hospital, between 1 month, he came complaints. When he came came into the government Ayurvedic hospital Usmanabad, complaints of right heel pain, severe swelling. On examination, pain near medial calcaneal tuberosity, tenderness, windless testis positive. We can correlate plantar fasciitis. 1 minute, sir. We can correlate plantar fasciitis with Vatakantaka. So here we are examining the Ashtavik Parikshan, that is Nadi, 82 beats per minute. Mutra Samyak, Mala Samyak, Jivaniram, Shabda Spashta, Sparsha Ushna, Dikha Spashta, and Akruti Madhyam. Next slide, please. Investigation, MRI report. The patient is diagnosed as plantar fasciitis. Method, we can use VAS scale, that is visual analog scale for pain, and soft tissue scale for tenderness. Next slide, please. What is the visual analog scale? In visual analog scale, the score is between 0 to 10. 0 means no pain, 1 to 3 means mild pain, 3 to 5 means moderate pain, 5 to 7 means severe pain, 7 to 9 very severe pain, and 10 means worst pain possible. For tenderness grading scale is used. Grade 1, patient complaints of pain. Grade 2, patient complaints of pain and wins. Grade 3, patient wins and withdraws the joint. And grade 4, patient will not allow to palpate the joint. Next slide, please. Treatment. We can correlate plantar fasciitis with Vatakantaka. And according to the Chikitsa Sutra of Vatakantaka, we use the Mrudu Shodhan and only the Jaloka Ucharan. Mrudu Shodhan with Eranda Tel 20 ml for 3 days at bedtime. And Jaloka Ucharan 6 setting with 7 days gap. Before Jaloka Ucharan, we can do Stanik Abhyanga and Nadi Svedhan. Next slide, please. Mode of action. What is mode of action? Mode of action of Mrudu Virechan. Vatakantaka is counted as among the Vata Vadis. Oleation, Snehana, and fomentation Svedana, followed by mild purgation, that is Mrudu Shodhan, are the first line of management of whited Vatas. Castor oil was given to eliminate doshas and malas by the mild purgation, that is Mrudu Virechan, by giving 20 ml for 3 days, where 6 Vegas were noted. After mild purgation, Samyak Lakshana was like proper evacuation of stool, mild reduction of pain, lightness in the body observed. Mode of action of Rakta Mokshana, Jalokaucharan, is also the purification therapy. So it can recommended to remove the whited doshas or the blood from the nearest site of disease or location. Roga Dishtan. In plantar fasciitis, tendons, that is kandras, are affected. Tendons are the substitute, that is upadhatu of raktadhatu, blood. Ultimately, upadhatu substitutes regaining the health back by the Jalokaucharan and reducing sign and symptoms of plantar fasciitis. Next slide. These are the some bioactive substances which are present in the saliva of Jaloka, which is helpful for the anti-inflammatory action. Next slide, please. So we was not use any anti-inflammatory drugs as Abhyantar Chikitsa, but only uses of Jalokaucharan, we get obvious results. These are the some reports of patient. Next slide, please. Follow. We was given 5 settings. 19/12/2020 is the first when patient come in the government Ayurvedic hospital Usmanabad. VAS scale is 8, that is very severe pain in the right ankle joint. Soft tissue scale is 3, matlab patient withdraws the joint. Patient can't give to palpate. Other symptoms, patient can't touch his foot on ground. Then after follow-up, first setting, second setting, third setting, and fourth setting, the VAS scale score is reduces like 6, 4, 4, and 2. Soft tissue scale is also reducing 3, 2, and 1. And the other symptoms like patient can't touch his feet on ground, but at the time of fourth setting, patient try to walk. And at the time of fifth setting, there is no symptoms. Patient can walk very easily, but there is very lightly or very mild pain is seen. Next slide, please. These are the results. These are the videos. Sir, videos can't support it, I think. These Before treatment, result, patient can't touch his feet on ground. And after the 5 settings of Jalokaucharan and 3 days of Mrudushodhan, after, patient walk very easily. Thank you, sir. Next slide. Conclusion, marked reduction in pain and tenderness was noticed after the treatment by Jalokaucharan in case of plantar fasciitis, that is Vatakantaka. The same can be assessed in large sample to evaluate the efficacy of holistic Ayurvedic management approach in the patient of plantar fasciitis. Jalokaucharan is a very cost-effective, less complicated, easy to practice, quick relief treatment that does not require surgical and hospitalization. Hence, Jalokaucharan can be acceptable alternative to the contemporary heel pain modalities of the pain signals either from the same area of the body or even many segments. Thank you. Next slide, sir. Thank you.
Thank you, doctor.
Next, I invite Dr. Rubali Keshav Rao. I invite Dr. Rubali. Doctor, please unmute.
Hello.
Good evening, doctor.
Good evening, everybody. Would you just wait? I have to share my screen here.
Hello, Dr. Ribali.
I'm trying to show my screen here.
Doctor, if you have any problem with screen sharing, doctor. Hello, Dr. Ribali. If you have any problem with screen sharing, doctor.
Just 1 minute, I'm trying.
You're correct.
Would you please help me to join this thing? I'm unable to do this.
Doctor, I will share for you, Dr. Ribali. Please start the session, doctor. If the screen is visible.
Good evening, everyone. Myself, Dr. Rupali Hanaute, second year Kromarhutya PG student. The topic of my presentation is Ayurvedic perspective of ADHD in children, guided by Dr. Chavan sir, GSC Nanded. Next, please. So ADHD is the most common and neurobehavioral disorder of childhood, where it is characterized by inattention, including increased distractibility and difficulty sustaining inattention, poor muscle control, and decreased self-inhibitory capacity, and motor overactivity and motor restlessness. Next. Affected children commonly experience academic underachievement, problems with interpersonal relationships with family and family member and peers, low self-esteem, and it co-occurs with other emotional, behavioral, language, and learning disorders. Next. Next, please. Around 9% school age children are affected to this disorder, where boys are more prominently shows hyperactiveness or impulsive, and girls shows inattentive. Next. So ADHD is not mentioned as an entity in Ayurveda. However, some irregular behavior has been recorded in Ayurveda that could possibly be linked with ADHD. So these Dhriti and Smruti, these are the three main components which these triggers of this component may causes irregular behaviors that leads to improper interaction between the senses and their goals. This results in impulsivity, overactivity, and inattention, which are the distinctive features of the ADHD. It is generally defined that there are two subdoshas in part of Smriti, where it contains of Sattvic and Manavaya, which controls the mind, sensory perception, and will. Next. Next, please. Exactly about the ADHD, we have similar signs and symptoms related to the condition like Unmada, whether Samprapti related to the Hruday, and Vata, which control the emotional instability, tics, conversion, talkativeness, body mass index, where Pitta give the characteristic of prominent anger, more disruptive, Upasai with the full article, self-learning behavior. Next, please. So there are mainly three main types of ADHD, where inattentive type has the main two components of kapha and tamoguna. Hyperactive and impulsive types shows two main component of vata and rajoguna, and third one is the combined type. Next, please. Next, please. So ADHD, that is hyperactive type, shows the characteristics of restless, lives 6 when stimulated, cannot play or engage in leisure activity quietly, always on the go, talk excessively, hours before the question is completed, has difficulty awaiting turns, and interrupts other conversations or games. Next slide, please. Second type of ADHD, that is inattentive type, it shows the characteristics of careless with details, fail to keep attention in the task, that is attention deficit, appears or not listening, does not finish constructed tasks, avoid tasks that require sustained mental efforts, loses things easily distracted by external stimuli, forgetful in the daily activities. Next slide, please. So these are some signs and symptoms of the ADHD. Next, please. So we all get to know that the Vata is the main culprit of this disorder, where the Chalaguna Ruddhi causes the hyperactiveness and Chalaguna Kshay causes late or no response, that we call not attentive. Dushya conclude of Majja Dhatu and Srotas conclude of Majjavaha and Manovaha Srotas, where the Adhishtan is Hruday, not brain. Manas Dosha conclude of Rajas and Tamoguna Ruddhi. Next slide, please. So ADHD involving mass, that is, it is diagnosed and treated on the line of Unmada disease. Next slide, please. Next slide, please. So Vata dosha is the before first one slide. So Vata dosha are the main component of this disease that affects the Manovaha Srotas. As a result, therapy that corrects the imbalance of dosha improve and normalize. we are going to use the most of the therapy that will be affect most over the Vata dosha. And brain problem with memory, intelligence, focus, learning capacity, speech production, etc. can prove successful in treating attention deficit hyperactivity disorder. In addition to psychotherapy, speech therapy, behavioral therapy, etc., this can be used as this can be used to accelerate the process. So there are some main principles where it includes Deepan and Pachana, Stroto Shodhan, Ahar Vihar, and Pathya. Where Deepan Pachana it corrects the digestive fire, digestive ama. In this way, it corrects the appetite, remove the canal obstruction by eliminating the ama, and helps to properly feed all the 7 tissues. And it will go reach to the brain and Hruday. Stroto that is cleansing the channel. Primarily the channel that perform brain functions are affected, that is Strotodushti. The natural flow of the doshas is obstructed and causes a loss of attention, learning impairment, and impaired memory. Next slide, please. Ahar, Vihar, and Aushadhi, these are the 3 main components of the treatment where diet, lifestyle, and medicine will helpful to accelerate the process. Avoid causative factors as much as possible. Avoid Vata Prakopak, Ahar, and Vihar. Vata Chalaguna can be controlled by the regular disciplined lifestyle by making the timetable, and also it can be accelerated by meditation, pranayam, adequate night sleep. Next slide. To control the Raja and Tamoguna, we need the Satvavajaya Chikitsa, which include psychological counseling. This counseling is the main component of the Raja and Tamo control. Assurance and supportive and loving atmosphere, music, and Atharva Shisha also. Increasing of Sattva Guna can be done by the Sattvic food, that is Sapak Ahar, and milk, ghee, dates, rice, wheat, green gram. And Rajasic and Tamasic food should be avoided. That is excessive spicy, chili, salty food, fast food, heavy to digest food, that is cheese, non-veg, which can create the ama, that is will cause the metabolic toxin. Next slide, please. Along with ahar, lifestyle, that is vihar, is also important. Ayurvedic daily regimen, that is waking up and sleeping time regularly, is important. We should maintain the timetable of the child. Regular exercise, walking in open air near to nature, sun salutation, brain occupied in positive things, cultivation of good habits like reading or listening motivational speeches, painting, crafts. Avoid the screen time for useless activity like gaming, seeing films with violence, and other horror films. Next slide. So we all get to know that the Vat dosha is the main culprit. So to treat the Vat dosha, we have 3 main components, that is Snehan, Swedan, and Basti. And Shodhan will improve this dosha. Detoxification of body as per the accompanying dosha. Pitta can be treated by the virechana, and the letharginess, the depression which is caused by the kapha dosh, can be treated by the vaman. Next slide, please. So brain is the main organ to nourish and important. Nasal medication is important. Murdha tel or Shirobhanga, Shiropichu, Shirodhara, Shiroti important. And the chikitsa included Hruday Basti and Urale. Next slide, please. The Panchakarma to treat ADHD disorder include Snehapan, that is by Kalyana Growth or Mahatikta Growth. Abhyanga can be given to increase the Vata and Pitta dosha by Kshir Baratel or Yashti Madhutel. Vata and Kapha dosha can be treated by Shirotelia with Yashti Madhutel with Amalki and Jatamasi. Vata Asti can be given by Kalyana Gruta. And and Pratimoshan Asya can be given by Anutel or Yashtimadgrut or Shirabala Tel or Brahmigru. Next slide, please. So these are some Shaman Chikitsa given below. Brihatvat Chintamani Ras, Kalyanak Gruta, Manas Mitravati, Brahmi Gruta, and Siddharthak Agat. Next slide, please. Along with medication, Patya Patya is also important, where Patya consists of cow milk, freshly cooked homemade food, ghee, carrots, gooseberry, khichdi, spinach, fresh seasonal fruits, and apathy that should be avoided in this ADHD syndromic children. That is spicy chili, sour, salty food, excessive tea, coffee, heavy to digest food like pizza, burger, cheese, alcohol, smoking, and drug addiction. Thank you.
Thank you, doctor. Thank you, Dr. Rupali.
Thank you, everyone.
Next, I would like to invite Dr. Debali Suresh Bodu for the paper presentation. Dr. Debali, are you there? Hello, Dr. Debali, are you there? Okay, next I invite Dr. Mrutul Sharikant Khadol for the presentation. Dr. Mrutul, are you there? Dr. Mrutul Sharikant Khadol, are you there? Okay, next I invite Dr. Ankita Khajpie for the presentation. Dr. Ankita, are you there? Hello, Dr. Ankita, are you there? Dr. Ankita, are you there? Okay, next I invite Dr. Savitha Bengale for the paper presentation. Dr. Savitha Bengale, are you there? Dr. Savitha Bengale, are you there? Hello, Dr. Savitha Bengale, are you there? Okay. Dr. Vaishali Dnyaneshwar Dhotre, are you there? Dr. Vaishali Dnyaneshwar Dhotre, are you there? Dr. Sachin Bahusahib Aghade, are you there? Dr. Sachin Bahusahib Aghade, are you there? Dr. Satwa Eknath Darade, are you there? Dr. Satwa Eknath Darade, are you there? Dr. Prajakta Chandrakant Vedre, are you there? Dr. Prajakta Chandrakant Vedre, are you there? Dr. Faisal Arif Khan, are you there? Dr. Faisal Arif Khan. Dr. Debari Suresh Bodu, Dr. Mrudul Srikant Khadol, Ankita Khajpie, Savitha Bengale. Are you there? Okay, I think today's presentation seems to be over. I would like to invite Dr. Aishwarya to conclude the session.
Thank you, Dr. Sapin. So it's an official end of Aatanka paper and poster presentation. Even though it's a small journey, but you all made it a success by your participation skill and choosing different topics. So I thank all the participants for your wonderful and active participation, and let me take this opportunity to once again extend my sincere gratitude to our faculty members. So, see you soon. Take care. Good night.
गुरुर्ब्रह्मा